Hi, Rich Miller here, former CEO of Virtua Health. I'm here today as the managing partner of Renuva HRT and Wellness. I'm here with Dr. Colleen McCleery, my friend, the practice leader here at Renuva. And Colleen, it's great to see you again. And I want to talk a little bit today, if we can, have a discussion about the community at large, the consumer at large regarding HRT. Tell me a little bit about what you're hearing from your patients. What are they seeing with their health and wellness?
We do have a lot of positive feedback of the patients who feel a lot better on hormone replacement. They come in excited to get started, especially if they have people who already are here, their friends and sisters and things like that are already coming. When they come in, they're getting excited about feeling better. You know, they're not sleeping, they're hot, they're having problems with functioning at work because of brain fog, stress, things like that. So they get very excited about coming in and they can't wait to get started to feel better. So they, are really just happy to be here and get their hormone replacement because they have heard so many benefits about it. So they're just really ready to get the ball rolling. They want to be in here before they even get all their information in. They're so happy to get here and get started. But they just feel so much better. They come in and they're, not sleeping, they're hot, they're not thinking, they're just really miserable. And then when they come back, they're like, oh my goodness, why didn't I do this years ago?
Earlier.
Yeah. Because they're just been so unhappy with what's going on with them.
So, we talk about once people learn about it and receive it, they're doing extremely well, like you said. Then we have patients out there that are really skeptical of HRT. I guess there's a lot, and not only patients, right, Dr. McCleery, we're also talking about physicians that are skeptical about it, other providers. So maybe talk a little bit about some of the myths that maybe people are hearing about HRT that aren't accurate.
22 years ago, there was a World Health Initiative. And sadly, that really put the kibosh on hormone replacement therapy, which is a shame because there's a lot of new research out there nowadays that has shown that really probably was a little overboard, basically. In that study was something called Premarin versus Prempro. And Premarin is an estradiol-based therapy. Prempro is the Premarin plus Provera. So in that study, what it's shown is that the Prempro in the early part of that study in 5 years had showed a slight increase in breast cancer. And then the Premarin side actually showed a decreased risk in breast cancer, interestingly enough, once they had looked at it in 20 years. That slight risk in breast cancer is actually not more than 1 glass of wine a night, which is a bar pour, which is only 4 ounces. We know that people don't pour just a bar pour.
No.
Being overweight or being sedentary, and sedentary really means, being not sedentary is exercising 120 minutes of moderate exercise a week. So those 3 things were more risk of breast cancer than HRT or estrogen therapy. And estrogen therapy has so much more benefits to you, meaning, decreased risk of osteoporosis, decreased risk of Alzheimer's, decreased risk of heart attack. I mean, let alone quality of life estrogen is. So there's people out there that think, oh my goodness, I'm going to get breast cancer if I take estrogen. If I just solely take estrogen, it's going to give me breast cancer. And I'll be honest, providers think that too. Like I've had patients come in here and say, I'm so terrified of taking estrogen because my provider told me if I take estrogen, I'm going to get breast cancer. I'm like, oh my goodness, I have to explain these to these people that, estrogen therapy alone is not going to give you breast cancer. And, even the cynics of the patients, they have actually come in here and said, oh, my sister or my brother or my uncle or whoever, or my mother said, oh, if you take estrogen, you're going to get breast cancer. And it's all stems back from that 2002 release to the media that said estrogen gives you breast cancer. And we cannot get that out of people's heads, which is sad, actually, because there's so many benefits to estrogen. And it's just providers believe this still. 80% of providers in a study.
Providers being physicians, correct? Yes.
Providers are physicians. 80% of providers still think that that's true. And there's so much more research out there that shows the benefits of estrogen. And I really think that we should, as providers, stop fearing estrogen and prescribe it.
Yeah, it's amazing. When you quote those statistics, that physicians are so adverse to this, and even people that go in and see their primary care physicians are being turned off to receiving HRT in any fashion.
Right.
We do a lot of pellet therapy here, bioidentical hormone pellet therapy, but you do a lot of other things for patients, right?
Correct. Yeah. What I feel is that, you have to look at the patient. I have a lot of tools in my toolbox. So not every therapy is right for every patient. So we, prescribe whatever kind of estrogen and testosterone therapy is right for that patient. So whatever tool is in my toolbox can be right for one person. The other tool might be right for another person. We use all the different estrogen and testosterone therapies out there for a person. And sometimes estrogen is not right for a person. Sometimes they do need to use just a local estrogen. It really depends upon the person. So we have to do it correctly for each person.
Right.
So we have to talk to that individual
So
person.
you design a care plan for each individual patient. Now,
Correct.
There's a lot of providers out there that are just not doing that, or they're not doing labs, or they're not doing individualized programs for their patients, and that's a problem, isn't it?
Correct. Some people are just giving everybody the same thing, or they're not listening to a patient's history. I mean, not one size fits all for everybody. I mean, this person might need a patch. This person might need pellet therapy. Person might need a cream. This person might only need systemic therapy, because you have to still be careful of when the person went into menopause, how old they are. But the good news is that there is a most recent research study that came out in April that women over 65 now can totally stay on estrogen for as long as they want, which is also good. But you have to keep up to date on all the research that's out there too.
Correct.
So you have to know what patients should get what.
Correct.
For sure.
That's great.